ठीक है. So these are the common complications that we see, emergencies, medical emergencies that we see at a dental office. Yesterday we talked about these 4. Today we are going to talk about these 4, but I'm not going to go in detail of this hyperglycemia because it is a medical emergency, but it is not much of a medical emergency at a dental clinic, because hypoglycemia, anaphylaxis, in सब में ना the patient can die within hours maximum. Anaphylaxis में तो within minutes, but whereas hyperglycemia patient will go from initiation of hyperglycemia to death in around 2 to 3 days. So there's ample time to shift the patient to a hospital. ठीक है. So I'll talk about it superficially, but detail में नहीं जाऊँगा. And airway obstruction जो कल का रह गया, we'll talk about that. Anyways, we'll start with anaphylaxis. Yeah, I forgot to mention one thing. Yesterday मैंने आपको बताया था, when the pregnant lady, when she lies down, the pressure from the fetus is over the inferior vena cava, and because of that venous return is hampered, right? And that condition is called as supine hypotensive syndrome of pregnancy. अगर पता था तो बताया क्यों नहीं, मुझे याद नहीं आ रहा था वो नाम. Anyways, we start with anaphylaxis. Anaphylaxis is, it is an exacerbated immune response. एक तरह से it is an allergy. So in allergy what happens is, at the first exposure to the allergen, कोई भी चीज़ से एलर्जी है, be it pollen, be it latex, be it local anesthesia molecules, at the first exposure, the mast cells, one second, the plasma cells, when they are exposed to allergens, they release IgE antibodies. Okay, antibodies are against foreign bodies, which the body considers as threats. Okay, now these antibodies they go and bind with the mast cells. Okay, now mast cells are like कि अब आने दो allergens को दिखाता हूँ मैं, है ना? It's like that. हाँ, आ जाओ. So they are ready for action. Okay, so whenever you see allergic response, it is not seen at the first exposure. It is always after the first exposure. It's not necessary second पे ही होगा. It can be third also. Okay, the symptoms, because the symptoms, the visibility of the symptom, it depends on how fast these IgE antibodies are produced. If they are slow, we can see the symptoms at the third exposure also. Okay, so mostly just remember, first exposure पे you don't see any symptoms because the body is preparing for the second attack. एक तरह से बोल सकते. Although the allergen, it might not be harmful to the body, but the immune system, it is recognizing all the allergen as harmful to the body, so it is preparing for the next exposure. ऐसा समझ. So when the next exposure happens, second exposure, the mast cells, they're ready for the attack एक तरह से. So when they are exposed to allergens, they release chemical mediators like histamine and cytokines. Okay, now these mediators, histamine and cytokines, they have effects on different tissues of the body. Specifically in allergy, it has an effect on the mucous membrane, nerves, and vascular vessel walls, blood vessel walls, and on the fibroblast. Because of that, it leads to hampered wound healing. But emergency में we are not concerned about wound healing. We are concerned about patient की life बचाना. Okay, so in emergency we are concerned about these things, the effect of these mediators, cytokines, histamines, on the mucous membrane, nerve, and the blood vessel walls. Okay, so we'll talk about these. So first is the effect of these mediators on the nerve cell. Okay, so the symptoms that we see because of this effect of the mediators on the nerves, that is pain, itching, also called as urticaria, and then there is sudden spasm of smooth muscles. Okay, now the smooth muscles, we find these smooth muscles in GIT and bronchioles of lungs. Okay, so suppose if the spasm occurs in GIT, now we have some food content जो भी खाया है पिया है in the GIT, there is sudden spasm. Okay, so the whole content is either pushed upwards, so patient will have vomiting. If it goes downwards, it will be diarrhea. Okay, so so pain, itching, and if the spasm in GIT occurs, then the patient will have vomiting and diarrhea. Okay, depending on in which direction the content is pushed. Okay, then we have bronchospasm. The smooth muscles of the bronchioles, they contract, so they reduce the size of the lumen of the bronchioles. Okay, So because of that, you can see this is the normal bronchiole, and we have this with the bronchospasm. Now remember this, there is still some airway exchange going on. The size has reduced to the abnormal size, but still there is some airway exchange going on. And we'll continue with this aage bhi. So remember these two things. The effect of these mediators on the nerve, it causes pain, itching, smooth muscle spasm. Smooth muscle spasm से a patient will have either vomiting diarrhea and bronchospasm. Now remember, जो भी मैं symptoms बता रहा हूँ, okay, there are times that all of them are not visible. Some of them will be visible, some of them are not there. Okay, so it's not necessarily सभी दिखेंगे, but you need to know all of them. Okay. So that is one thing. Then we come to the effect of these mediators on the mucous membrane. Now mucous membrane, there's only one effect actually, increased mucus secretion. Okay. So if there sorry, if there is increased mucus secretion, this mucus lining is also present in the bronchioles. So there will be increased mucus secretion, and along with the bronchospasm, there is further reduction in the size of the lumen. है ना? Still again there is some amount of airway air exchange going on. There is not, it isn't a complete blockage. Okay, so what you will see is patient trying very hard to breathe, dyspnea will be there, and you'll hear wheezing sounds. Let me see if I have. So as I said, there will be partial blockage of the bronchioles. Now let me show you the wheezing sound if it is. Okay, for some reason, one second, let me show you. ये है तो चालू, फिर क्यों नहीं आ रहा है? बाद में बता दूंगा. So basically wheezing sound is ideally heard on a stethoscope, but if the wheezing sound is a little loud, you can hear it directly also. Okay, so because of this increased mucus secretion and bronchospasm, you will have wheezing and dyspnea. Okay, let's go now. Now the effect of these mediators on the blood vessel, they cause increased permeability. Now let me talk about first increased permeability. Permeability, the plasma. Blood can be divided into plasma and the cells that are present in the blood. Okay. Now if the plasma, if there is increased permeability, the plasma it goes into the interstitial space. Okay, outside the blood vessel. Okay, so there is accumulation of fluid. You can say interstitial, this plasma, it is a fluid. There is accumulation of fluid in the interstitial spaces, soft tissue mein. Okay, basically. So what happens? You'll see inflammation. You'll see swelling. Okay, that is one thing, and also you will see reduction in the blood volume. Okay, we have only more number of cells now comparatively and less number of fluid. Okay, so there is hypotension. Okay, reduction in blood pressure. That is one thing, and then we have vasodilation also. Okay, generalized vasodilation is there, and that will further aggravate the hypotension. Okay, samajha? Both these two things, they are going to contribute to hypotension. There will be marked hypotension first. Now, as I said, there is vasodilation. So usse kya hoga? There is pooling of blood in the under the skin. So what you'll see is flushing, or also called as erythema in the patients. There is increased accumulation of fluid in the interstitial tissues. Because of that, you will see running nose, or you will see watery eyes. Okay, and as I said, collection of fluid in the tissue space. You might see it as edema also. Okay, angioedema bolte hain, around the lip and other areas also. And if this edema, as I mentioned earlier, it is the vasodilation and increased permeability will lead to hypotension. And if this edema can occur as hives also. These are small elevated patches. These hives are accompanied with urticaria, intense itching. That is because of the effect of the mediators on the nerve endings. Okay. Now, if this swelling, this edema is seen on the larynx. Okay. So there will be swelling. Normal vocal cords are like this. When there is swelling, these vocal cords are shut. Okay. Now if this happens, there is complete blockage. There is no airway exchange. Okay. So this is these vocal cords are present at the upper airway, and bronchioles are at the lower airway. So if there is upper airway obstruction because of this edema, there is laryngeal edema, that will lead to complete blockage. And if there is a lower airway obstruction because of this bronchospasm and increased mucus secretion, there will be some air exchange. It's not complete blockage. Okay, so dyspnea and wheezing will be there in case of bronchospasm. Agar dono hai to there won't be any air exchange, because this jo bronchioles mein there is a possibility of air exchange, but if there is laryngeal edema, there won't be any air exchange. Okay, samajh aaya itna? Okay, so we have these symptoms. So this is how we are listing out all the symptoms, signs and symptoms. So so there is bronchospasm and laryngeal edema that will lead to hypoxia because air exchange is less. Okay, hypoxia is there. So what hypoxia, it shows as bluish discoloration of fingers, nail beds, lips, right? So you will see cyanosis. Okay, signs and symptoms bata raha hu ye sare. Cyanosis. Now there is less oxygen in the blood. Okay, but the heart has to meet the oxygen demand, so it starts beating at a faster rate. Okay, so you will see tachycardia, and we have already discussed that hypotension is there. Okay, another reason for hypotension is that there is less oxygen supply to the body, so less oxygen supply to the myocardium is there, right? So force of contraction is also less. Even that will add to hypotension. Samajh aaya? Then if this continues, myocardium has less oxygen supply and less force of contraction is there. So if this hypoxia continues, the patient will have angina pain. Samajh aaya? Because the myocardial muscle, it shifts to anaerobic metabolism, and because of that there will be lactic acid accumulation in the muscles, and that will lead to angina pain. Okay? And that if that continues, there will be less supply of oxygen to the brain. Okay, so there will be loss of consciousness, and if this continues for a longer duration, patient will die. ठीक है? समझ आया इतना? Okay, so these are all the signs and symptoms. Pain, itching, that is because of the nerve endings. Wheezing sound and dyspnea is because of the bronchioles, bronchospasm and the increased mucus secretion. Abdominal cramps, that leads to nausea and vomiting. Abdominal cramps क्या? Smooth muscle contraction. Okay, in the GIT, so that leads to nausea, vomiting and diarrhea. And there is a marked vasodilation that will lead to erythema, and sorry, there is increased permeability that leads to angioedema, hives and running nose. Chest pain is because of the hypoxia, that is secondary to airway obstruction, be it lower airway or upper airway. Okay, laryngeal edema or bronchospasm hai, that will lead to hypoxia, and that leads to chest pain, that is ischemic heart disease, angina or myocardial infarction to hoga, angina pain. Okay, and tachycardia, as hypoxia is there, the heart tries to compensate, so it beats at a faster rate. Okay, hypotension is there. Dysrhythmia, if this condition continues and there is cell death in the muscles, myocardium, that will lead to dysrhythmia. Okay, and if this continues further, cardiac arrest and unconsciousness and death of the patient. Okay, samajh aaya? Now we come to the management. We have already talked about position, circulation, ये सारी चीजें है ना. Now in this it is important that we talk about airway and breathing. In this case, heart is fine, we know. Okay, the effect on heart is secondary to the airway because hypoxia is there. Because of that, circulation is hampered if hypoxia stays for a longer duration, right? Okay, so in any emergency, what we are concerned with is airway, breathing, circulation, airway and breathing, right? So in this, if we are sure that it is anaphylaxis, okay, so we know we need to make sure that the airway is open for the patient. Okay, we need a drug that is going to make sure that the airway is open, and it has to counter the hypotension. Remember, hypotension bhi hai, so we need to counter two things in this: airway and hypotension. Airway, one of the reasons for compromised airway is spasm of the smooth muscles. So there's one drug that can cause generalized smooth muscle relaxation. Arey sabar kar. Okay, there's one drug that causes generalized smooth muscle relaxation and vasoconstriction. Vasoconstriction will lead to increased blood pressure. What is the drug? Ab to naam batao. Vasoconstriction किससे होगा? Anaphylaxis का first line of treatment is epinephrine. Now you know why epinephrine is the first line of treatment, because it causes relaxation of smooth muscle. So what will happen if there is bronchospasm? Okay, if there is bronchospasm, there is wheezing sound. You know there is bronchospasm. It is not laryngeal edema. Okay, so bronchospasm होगा, bronchospasm है because of epinephrine, the smooth muscles relax, so there will be widening of the lumen of bronchioles, so air exchange will increase. That is one. Second, hypotension will be reversed. Okay. समझ आया? So our first line of treatment, for if we are sure that it is not upper airway obstruction, that is laryngeal edema, then we manage it with epinephrine. If we think there is no air exchange and if we are sure that it is laryngeal edema, there is no airway exchange, ऊपर से block हो गया है, so we'll have to open the airway lower to that point, right? Okay, so what are the two options? Either tracheostomy or cricothyrotomy, right? यहाँ पे एक गले में होल बना दो, पेशेंट विल ब्रीथ, खत्म बात. देयर इज अपर एयरवे ऑब्स्ट्रक्शन बट वी कैन ओपन इट फ्रॉम दिस एरिया. ओके, विल टॉक अबाउट, आई एम नॉट गोइंग टू गो इन डिटेल अबाउट ट्रेकेस्टमी, इट इज अ टेक्निक सेंसिटिव प्रोसीजर, बट क्राइकोथायरोटोमी आप अपने क्लिनिक में इजीली कर सकते हो विदाउट डैमेजिंग एनी वाइटल स्ट्रक्चर्स. ओके, आई विल शो यू द इमेजेस एंड वीडियोज. So basically, as I told you, airway open करने के लिए, if you think there is upper airway obstruction, laryngeal edema, so you do cricothyrotomy or tracheostomy. We'll throw out tracheostomy abhi, it is technique sensitive. We'll talk about cricothyrotomy. So isme what we do is, let me switch to laser pointer. So what we do is, we have this Adam's apple prominence, है ना? That is the Adam's apple, that is what? बताओ ना, thyroid cartilage, है ना? Okay, if we palpate, just we come just below it, we feel the depression and then we feel the cricoid cartilage. Okay, so there is this membrane between the two structure, two cartilages, that is called as cricothyroid membrane. Okay, this is a structure, उसके ऊपर we just have the skin and medial to it we only have the mucosa. Okay, mucous membrane. So we just tap the area. We don't have any important vital structure. We can go directly in this area. Okay. So कैसे करेंगे? We just give an incision. I had a video. I removed it because जल्दी खत्म करना है. We just place the ET tube, endotracheal tube, and patient starts breathing. That is one. Optionally, what you can do at your clinic, this is important. You can take 4 to 5 18 gauge needles and just insert them into the cricothyroid membrane. 5-6 mm के depth में, if you insert it, it will go into the trachea and the patient can breathe easily. Even if there is upper airway obstruction, we have inserted the needles in this area. Okay, 4 to 5 needles, that is more than enough. Suppose you don't have these needles, if you have a blade, 15 number or 11 number blade, so what you can do, you can give an incision and blade का distal end, जो blunt end है, you insert it and rotate it. You'll see. So we give an incision in this cricothyroid membrane, we insert the blade blunt end and just rotate it and keep it open. समझ आया? Patient गालियाँ नहीं देगा वो टाइम पे. You're saving the patient's life. Patient is going unconscious. Okay. Suppose ये भी नहीं है. So this is going to be a little traumatic. You can use a pen's barrel and just stab it. ये किसी मूवी में देखा है किसी ने? There's one movie, Saw 4 or 3. In that there's a scene. उसमें है actually the guy is trapped with his head in a water bowl. हाँ, so उसके head में, his head is in the water. Okay, यहाँ से free है. So what he does is he takes out the pen and stabs his neck with the pen, and he starts breathing. देखना कभी होगा. So we talked about currently in anaphylaxis we are concerned about airway and breathing. If we control this, circulation automatically is fine. Okay, so now we come to definite, है ना? Okay, so as I mentioned earlier, we'll give epinephrine 0.3 mg, 1:1000 concentration. If there is no improvement, we have to repeat the dosage every 10 minutes. Once the patient stabilizes, we're going to give bronchodilators also. Albuterol, salbutamol, and of course oxygen की कमी, hypoxia, we'll have to counter hypoxia, so we're going to give oxygen. Okay, and of course during all the medical emergencies you have to monitor vital signs of the patient. Okay, now this is basically inflammation, there is swelling. Okay, so we have to give steroids also and antihistaminic. It is because of histamine, right? So we have to give antihistaminics also, right? Understood? Jaldi kiya, but I tried to keep it as thorough as possible. Now we come to hypoglycemia. Okay, so basically it is, I would say, after anaphylaxis, it is the fastest one to kill the patient. Okay, but it is the easiest one. क्यों? बस एक चॉकलेट खिलानी है, पेशेंट ठीक हो जाएगा, राइट? बट that is when the patient doesn't have any medical history. Now hypoglycemia, most of the time if it is threatening it is because the patient already has a history of diabetes. Now if you might think that diabetes में hypoglycemia कैसे होगा, so patient, if he is a known diabetic, what happens? He takes oral hypoglycemics, right? So suppose for an appointment, the patient comes for an appointment, उसने आने से पहले अपना proper dosage लिया oral hypoglycemics का, but he didn't take any food. Okay, now the because of the oral hypoglycemics sorry so blood sugar level कम हो रहा है, but we are not adding any sugar to the blood because the patient खाना ही नहीं खाया है, so that will lead to hypoglycemia, right? Anyways, back to some basics. As we discussed yesterday, brain works throughout the life. It needs uninterrupted supply of energy, and it uses oxidative phosphorylation, oxidative metabolism, okay, aerobic metabolism. So if there is reduced blood supply, oxygen supply or glucose supply to the brain, it will lead to unconsciousness, and if it leads to a longer duration, if it stays for a longer duration, it might lead to death of the patient, right? Okay, and brain consumes 65% of the total blood glucose of the body, okay. Now we'll remember our basic जो insulin का cycle रहता है. When we eat food, the glucose derived from the food is added to the blood, right? Now this blood with the help of insulin is taken up by different body parts to use to perform various functions, and then there is some portion of glucose that is not utilized. With the help of insulin, that is stored as glycogen in the body as fat, right? And whenever required, whenever need arises, this glycogen is converted to blood glucose back with the help of glucagon, cortisol or epinephrine, okay. Preferably glucagon से होता है. In absence of this, we use the cortisol and epinephrine can also work as that, okay. इतना simple है. And normal blood sugar level, ये सब है, remember that. Now in a diabetic patient, as we talked earlier, if the patient is on insulin on oral hypoglycemics and the patient forgets to take the meal before coming to the clinic for the treatment, okay, so the patient might go into hypoglycemia, okay. So these are the symptoms that you see in case of hypoglycemia: lethargy, blurring of vision, sleepiness, slurring of speech, lack of muscle coordination, tachycardia, glucose कम हो गया है. Again, to compensate that, the heart will work at a faster rate, beat at a faster rate, okay. And if stays for a longer duration, unconsciousness and coma and death occurs, okay. But if you recognize this condition within immediately and you give just glucose to the patient, like if the patient is conscious, you can give him orally glucose, chocolate, any sweet, ठीक है, the patient regains conscious, patient is back to normal, okay. If the patient is unconscious, then what we do, we just give the patient IV, okay, DNS or dextrose solution, okay, glucose, that's it. And of course stop the procedure, PCAB, and we give glucose to the patient, that's it. और कुछ नहीं है इसमें. सपोज आई फॉरगॉट दिस, ग्लूकोज दिया, सपोज आपके पास ग्लूकोज नहीं है, डीएनएस डेक्सट्रोज सोल्यूशन नहीं है, देन यू कैन व्हाट यू कैन डू इज यू कैन गिव ग्लूकागोन. ग्लूकागोन क्या करेगा? इट विल कन्वर्ट द बॉडी ग्लाइकोजन इनटू ग्लूकोज, दैट विल लीड टू एलिवेटेड आरबीएस, नॉट आरबीएस, ब्लड शुगर लेवल, राइट. सपोज ग्लूकागोन नहीं है, देन वी कैन गिव स्टेरॉइड्स, है ना. एंड इफ दैट स्टेरॉइड इज नॉट देयर, देन वी कैन गिव एपिनेफ्रिन. ओके, मैंने ऑर्डर उल्टा हो गया है, बट यू गेट द पॉइंट, राइट. हाँ, समझ आया इतना? आई एम गोइंग फास्ट बट आई ट्राई टू कीप इट एज सिंपल एज पॉसिबल. नाउ वी कम टू एयरवे ऑब्स्ट्रक्शन. नाउ यू आर डूइंग अ डेंटल ट्रीटमेंट, दांत निकाल रहे हो, स्लिप हो गया, स्लिप होकर नीचे गिरता है मोस्ट ऑफ द टाइम, बट पेशेंट के मुंह में गया. नाउ मोस्ट ऑफ द टाइम द पेशेंट इज कॉन्शियस एंड द रिफ्लेक्सेस दे किक इन एंड द पेशेंट कफ्स एंड थ्रोज द फॉरेन बॉडी आउट ऑफ द माउथ. बट सपोज गलती से थ्रोट में चला गया, ही इज नॉट एबल टू पुश इट आउट, अंदर जाएगा टूथ और एनी फॉरेन बॉडी. सपोज यू आर रिमूविंग अ क्राउन, वो अंदर चला गया, और अ प्रोस्थेसिस इट गोज इन. majority of the time it goes into the esophagus. Esophagus में गया तो सुबह बाहर निकल ही जाएगा, है ना. Suppose if it goes into the trachea, okay, through the larynx, तो क्या होगा? Let me show you the images. As I told you, ये सारी चीज़ें हैं. It will be expelled out because of the the what do you say, reflexes. Okay, हाँ. So how do you prevent this? Suppose foreign body है, foreign body जा रहा है, how do you prevent it from going in? One is, of course, you can use a rubber dam. That is for endodontic treatment. Of course, extraction में तो use नहीं करेंगे. आप लोगों ने rubber dam use होते हुए देखा है ऊपर? नहीं देखा है तो देख लेना. This is how a rubber dam is used to isolate the area. The advantages is one, foreign body. First of all, the advantage is वहाँ पे वो कुछ भी saliva contamination नहीं होता है. Okay, it isolates the area well. And second, foreign body अंदर नहीं जाएगा. Okay. Then we have an assistant who should be well trained, and if suppose any foreign body goes into the throat, the assistant can use the Megel's forceps and hold it and take it out from the throat, right? Suppose you don't have an assistant, chair position तो बात की बात है. Suppose you don't have an assistant, so what you can do, अगर patient के मुंह में गया है, this is for prevention, that is होने से पहले ही जस्ट जा ही रहा है एंड द पेशेंट ने निकाल लिया. सपोज अगर हो भी गया एंड द असिस्टेंट, आइडियली इफ यू हैव अ ट्रेन्ड असिस्टेंट, द असिस्टेंट विल इजीली टेक इट आउट, राइट? बट सपोज द असिस्टेंट इज नॉट देयर एंड इफ यू आर अलोन, व्हाट यू कैन डू इज यू कैन आस्क द पेशेंट, जो हैंडल रेस्ट होता है, जस्ट वहाँ पे लीन डाउन एंड आस्क हिम टू कफ as forcibly as he can, and that will push it out, because gravity की भी direction में, if the patient is lying down like this, the gravity is pulling it downwards into the throat. If the patient is like this, it will come out, right? So use gravity to your advantage, जो कि syncope में हम देख चुके हैं, right? And chair position, if the patient is totally supine, it is easier for the foreign body to go into the throat. If the patient is semi-supine or upright, that will be difficult for the foreign body to go directly into the throat, right? So chair position भी important है. As I told you, if the object goes into the esophagus, so आ जाएगा. If it goes into the throat, which is the chances are less, but sometime it goes in. Okay. अगर है तो it will usually go into the right bronchiole. I'll show you the images. Okay. So suppose if the airway obstruction has occurred, the foreign body goes into the throat of the patient. क्या करेंगे? If the patient assistant is present, okay, and the patient को supine position डालो, use the Megel's forceps and take it out. Okay. If the patient is assistant is not present, as I told you, ask the patient to lean on the handle rest of the chair, dental chair, and ask him to lean down and cuff as hard as possible. Okay. This position is only when the assistant is there with you. Okay. Otherwise नहीं करना है. And again, if the assistant is there, the assistant will take it out with the Megel's forceps. And this is कर सकते हैं, but preferable if we ask the patient to be leaning on the hand rest of the chair. Okay, that is one. Okay, if it goes into esophagus, actually radiograph लेके you should ascertain where the foreign body or the tooth or the crown is there. And mostly, as I told you, कुछ करने की ज़रूरत नहीं है. जो whoever the specialist you consult, be it a radiologist or gastroenterologist, वो भी यही बोलेगा कि कुछ नहीं करना है, सुबह आ जाएगा. ठीक है ना? That's right. Yeah. So we come back to the larynx. If it goes into the larynx, what happens is okay. So if this foreign body goes into the trachea, so most of the time, like majority of the time, it goes into the right branch, not onto the left branch, because left branch is at a more angle, 20-degree more angulated as compared to the right side. So there is a high chance that it will go into the right side. Okay. So airway obstruction होगा तो क्या क्या देखेगा? Patient बोल नहीं पाएगा, patient will not be able to breathe, patient will not be able to cough if it is complete obstruction. Okay. If there is partial obstruction, as we discussed earlier, there will be some wheezing sound. Patient will be able to breathe. This is all when there is good airflow. Suppose there is a partial obstruction, but there is air action is poor, then there will be crowing sound. जैसे movies में दिखाते हैं, जैसे गला खराब हो गया तो कैसे crowing sound में बात करते हैं. That will be something like that. Okay. And the patient won't be able to talk. Now, as discussed in anaphylaxis, there will be less air exchange. So there will be cyanosis, lethargy, disorientation. If it continues, there will be ischemia, the pain, angina pain will be there. And if it continues, patient might die. Okay? यार ये सारे change नहीं किए मैंने. Okay. So these are all the signs and symptoms. So what you will see, if there is complete obstruction, there will be universal choking sign. This is the universal choking sign. Okay, so what ये भी हो गया. So now we come to the same PCABD है. This is the old PPT, वहाँ से मैंने मेरा उठाया है. So just remember PCABD है. This is not PABCT. Now position, airway, we've already talked about look, listen and feel technique, right? Now if there is complete obstruction, establish airway with invasive and non-invasive procedures. So suppose non-invasive procedure से कैसे, if there is a foreign body in the trachea, now what you'll do is you can use Heimlich Maneuver. Heimlich Maneuver, let me show you if there is image. Okay, yeah. So what you can do is 2 inches above the navel, you place your thumb like this and you pull it upward and backwards. Okay, you're going to stand behind the patient, you keep your arm around the patient and you pull it upward and backward. So इससे क्या होगा, you're going to increase the pressure, you're going to push the diaphragm against the lungs, you're going to increase the pressure over the lungs. Because of this sudden pressure, the air is expelled out with force through the lungs. Okay, so through the trachea. So if there is any foreign body in the trachea, there is a very good chance that it will be forced out of the trachea, right? Because of the sudden burst of the air. Okay, that is Heimlich Maneuver. Again, thumb like this, upwards and backward movement देना है in this direction. Okay, and this is the point of applying pressure. Suppose this is not possible with the patient. Patient जब conscious है तब ये कर सकते हैं. Suppose if the patient goes unconscious, तब क्या करेंगे? उसको ऐसे लटका के तो नहीं करेंगे. What you do is the patient chest thrust technique or Heimlich Maneuver will make the patient lie down and then downwards and backwards to the patient. Then we have chest thrust technique. We just apply pressure over the chest of the patient, sternum. Okay, similar to CPR एक तरह से. So we just increase the pressure in the chest region so that there is sudden air that is expelled out of the lungs. The same principle lies here, just different method. Okay, इसमें we just pull it backwards. The application of force is backwards. Okay. In case of a child patient, usually you won't have a child patient this small, but if you have, keep the patient like this so that if the patient is upright, suppose the gravity pulls the foreign body downwards. If the patient is like this, gravity pulls the foreign body downwards, and we are applying with 2 fingers, applying pressure over the sternum of the patient. Okay, so again the same principle, air is expelled at a higher force and good possibility that the foreign body comes out. Okay, then we have back blows technique. Again the same thing, in the direction of gravity, and we apply blows. Again we are increasing the pressure. We apply the blows with this palm of the hand. Okay, then we have suppose if there is upper airway obstruction, we can go for cricothyrotomy and tracheostomy. Okay, I think मैंने आपको images बता दिए हैं, तो I don't have to show you this. Okay, so any doubt इसमें? I went a little too fast, but any doubts in these 3 topics? Okay, so now we come to hyperglycemia. So if you remember, I told you hyperglycemia, mostly it is in diabetic patients, right? Problem क्या है? As I told you, the patient won't die immediately. You have 2 to 3 days to ship the patient to a hospital. Okay, that is to your advantage. So I don't consider it as a medical emergency to you immediately in the dental clinic. Okay, in fact, I would say in my private practice, I used to carry only epinephrine with me, because that is the only medical emergency I find that अगर नहीं हुआ patient निकल लेगा. Whereas you can find glucose or chocolates everywhere. अगर hypoglycemia हुआ तो that can be managed there also. But the drug that I carry with me for my personal cases, that is epinephrine, क्योंकि वही है, अगर वो नहीं हुआ तो नहीं बचेगा patient. Okay. Now suppose there is hyperglycemia. Why is hyperglycemia? Patient ने खाना खा लिया है, patient is diabetic. So what happens? Insulin isn't working fine, है ना? तो क्या होगा? There is a increase in blood sugar level. Now there is sufficient sugar, glucose in the blood, but the body is not able to use it. Okay, to the body that it is deficient in glucose. There is glucose present, but it is not able to use it because of the impaired insulin production or impaired receptors, right? So क्या होगा? The body goes, it takes another route to produce energy. Okay, so it takes the fat from the body and it starts deriving energy from the fat of the body, and the byproduct of this process is ketones. Okay, now these ketones, as they keep on accumulating in the blood, you have diabetic ketoacidosis, right? Now because of the accumulation of the ketones in the blood, क्या होता है, pH of the body reduces, not the body, blood reduces. Okay, now pH goes down. Now if you remember yesterday, hyperventilation में pH क्या होता है, it increases. Now to counter the the pH going down in diabetic hyperglycemia, patient starts breathing at a rapid rate. Okay, to counter this what do you say, acidic pH, to bring the pH of the blood to a normal level. समझ आ रहा है? कल हमने डिस्कस किया था hyperventilation causes increase in pH, whereas in hyperglycemia it is going down because of the ketone body. So when the patient starts hyperventilating, the body is trying to bring the pH to a normal level. समझ आया? So you will see Kussmaul's breathing, something called as Kussmaul's breathing. उसमें patient breathes rapidly, okay, and deep sometimes. So इसमें क्या होगा, if it is for a longer duration, the patient will go into diabetic coma. अगर वो भी चलता रहा, if you don't manage that, the patient will die, right? So management क्या होगा? Just give the patient ये insulin. The body is able to take up the insulin, the glucose. The body is able to go back to the normal route. Okay, normal route, oxidative phosphorylation and ketone production कम हो जाता है. Slowly and gradually the ketone is removed from the body and the patient regains normal health. समझ आया इतना? So with this we complete the medical emergencies.